Welcome back. As I told you, I will be talking about each system of the endocrine, that is, each gland in detail. So, today we are going to understand the pituitary gland, that is, the hypophysis, which is also known as the master of the endocrine orchestra. This pituitary gland has basically got two endocrinal parts, the anterior and the posterior pituitary. So, this anterior pituitary is totally glandular in nature, whereas the posterior pituitary is neurogenic in origin. But both of these parts have got some role to play in the endocrinological controls. So, now, next. Okay. Now, if I look at the pituitary gland, it has got one part, the anterior pituitary or the adenohypophysis. Now, as the name suggests, adeno means gland. So, it is getting influences from the hypothalamus. The posterior pituitary or the neurohypophysis, as the name suggests, its origin is from the nervous tissue. It is influenced by the nervous signals from the hypothalamus. The hormones which are secreted by the anterior pituitary are the most important, the growth hormone, followed by prolactin, then the thyroid stimulating hormone, adenocorticotrophic hormones, the follicle stimulating hormone, and the luteinizing hormone. The posterior pituitary secretes two hormones which are not manufactured in the posterior pituitary, and they are the vasopressin, also known as the antidiuretic hormone, and the oxytocin. And oxytocin has got a very, very short and specific role we'll be seeing further. The anterior pituitary, as we can see, has connections with the higher center of the brain, the hypothalamus, and it directly influences the secretion of all the glands of the body and similarly of the pituitaries. Now, the growth hormone has got certain functions. It stimulates the growth of bones, cartilage, and connective tissue. It is a very, very important hormone in the growing children and totally controls the growth of an individual. And if it is not secreted in the right amount, then it leads to dwarfism. Now, somatomedins are synthesized in the liver in response to the stimulation by the growth hormones. And the effect of the growth hormone on the skeletal system is mediated by these somatomedins. It means that in the process of growth of the bony structures of the skeletal system, the liver plays an important role. So we have to understand this from a clinical point of view, that a healthy liver with healthy secretory functions is so important in children. Now, the second effect of the growth hormone is on protein and mineral metabolism. Now, growth hormone has got an anabolic effect on proteins. Yes, of course, the building up. If it will build up, only then will it produce growth. On mineral metabolism, it causes increased calcium absorption from the gut, and that is why it is able to help in the growth of the bones and the muscles. Now, decreases sodium, potassium, calcium, and phosphorus excretion from the kidney, or we should say it regulates the excretion of different minerals via the kidney. On carbohydrates, it is diabetogenic, which means it produces hyperglycemia, which means it increases the disintegration of the carbohydrates, or we can say it has a catabolic effect, a breakdown effect on carbohydrates. Obviously, when there will be an anabolic effect on the proteins, there will be a building up process in the body, there will be a growth mechanism operating in the body, then we will require energy. And where does this energy come from? From the carbohydrates. So the growth hormone in itself is doing a complete action to facilitate growth. On fat, again, it has a catabolic effect. That is, it mobilizes the disintegration or breakdown of fats. And see, if you will observe, in young growing children, say from 7 years to 14, 15 years of age, we see that they grow vertically. And we all say that they are becoming very lean, they look very thin, but actually they are going through a vertical growth, after which the girth-wise growth occurs once there is the solidification of the diaphyseal region of the bones. So it is a very, very important thing to note that children of this growing age normally should not put on weight, because the growth hormone is causing the breakdown of the fatty material. Now, the control or the release of this hormone is totally under the higher centers. Okay, so these higher centers have got two types of hormones. One hormone that is the releasing and one hormone that is the inhibiting hormone. These are both secreted in the hypothalamus, which is the higher center for all the endocrine activity. Now, in case of growth hormone, the inhibiting hormone is almost very less active or very less functional. It is largely the releasing hormone which controls the secretion of the growth hormone, and it is hyper secreted in exercise and stress. So all the children who in their growing age will do a lot of exercise, will undergo physical, muscular stress, will definitely grow taller. Now, there are a lot of diseases which we will not be talking much about. Excessive growth hormone causes gigantism, which is too large stature. In males, the mammary glands enlarge and the condition known as gynecomastia results. And also, the hands and feet may become large. In another thing which occurs if excessive growth hormone is secreted in the childhood is acromegaly, and it can be clearly seen in a very, very broad face, thick nose, broad eyebrows, and a widened mandible. If the growth hormone is deficient, the person becomes dwarf. And one more very important thing which I would like to mention here is that this dwarfism results in smaller structures of the body size, but not in sexual inability. So the person is, if the dwarfism is because of panhypopituitarism, then there is effect on the fertility of the person and the ability to perform normal sexual activity. But if it is only because of the growth hormone, the size may reduce, but it may not affect the person's ability to perform sex. So now here, another thing is very important, that if we really want to overcome this dwarfism, this growth hormone deficiency has to be identified and proper hormonal therapy has to be done before the fusion of the metaphysis of the long bones. That is somewhere before 18 years of age, so as to come over this. The second hormone of the anterior pituitary is the prolactin. As we know, it is very important for development of the mammary glands and the formation of the milk. We can see that there are other factors also which stimulate the secretion of this prolactin. For example, exercise, emotions increase it, pregnancy and breastfeeding. Now, there are certain inhibitory factors which suppress the prolactin secretion, like the anterior pituitary secretions which suppress it. Dopamine is said to have a suppressive effect on this prolactin. Now, the third hormone is the thyroid stimulating hormone. As the name suggests, it goes into the blood. It is having its receptors in the thyroid glands. And if this TSH is secreted in the appropriate amount, T3 and T4 are manufactured from the thyroid gland in the right amounts, and the metabolic activity is a proper regulated manner. But in case there is a suppression of the TSH, then or an hypersecretion of the TSH, in both the cases, we will find an altered secretion of the T3 and T4, and hence a effect on the metabolic activities at large. Now, in hypothyroidism, when we see the report of a patient, we have to see that a TSH has risen because of negative feedback mechanism. That is, there was low TSH, body stimulated it to increase the secretions, and this TSH has been increased, resulting in a normal T3 and T4. So you have to learn to see the reports of patients who are presenting with thyroid disorders. In the second category of trophic hormones from the anterior pituitary, we have the adrenocorticotrophic hormone. Now we know the adrenals are a very, very important endocrine gland, secreting more than 3 important steroidal hormones and non-steroidal corticoids. So these hormones are very, very important for a lot of functionings of our body. So this ACTH secreted from the anterior pituitary regulates the secretion of the adrenal glands, the outer layers of the adrenal glands. And this normal secretion is very, very essential to have a normal hormonal activity of the reproductive structures, to have a normal hormonal activity of the metabolic hormones as well. So the mineralocorticoids, glucocorticoids, and the sex steroids secreted by the adrenal glands are regulated by the ACTH from the anterior pituitary. Now we have the FSH, the follicle stimulating hormone, which stimulates the ovarian follicles. But we will not be studying the ovaries here with the endocrine system because we have a separate chapter of it in physiology known as the reproductive system. But I'll be telling you about the FSH. FSH again is secreted by the anterior pituitary. It regulates the development, growth, pubertal maturation, and the reproductive processes of the body. We can say it controls the regulatory mechanism of normal pubertal functioning. And FSH is only a hormone of the female. Similarly, the LH, the luteinizing hormone, again secreted by the anterior pituitary. Now, this LH has got a very, very important action on triggering of ovulation and the development of the corpus luteum in the non-pregnant uterus. So, if we look at its function, we will understand that this luteinizing hormone causes ovulation in the mid of the menstrual cycle, I mean in midpoint of two menstrual cycles. And since the ova is released and not fertilized, it will be wasted or thrown out of the body. The corpus luteum will be formed in the ovary, and this is regulated by the LH. It also has a slight function in the males in the production of the testosterone. Now, here we have also mentioned the intermediate lobe, which I will not be detailing out here for your level. There are few hormones which are mentioned with it. Basically, I'll tell you that this melanocyte stimulating hormone, the MSH, affects the deepest layer of the skin, that is the granulocytes, to produce the melanin, which is a protective pigment. But it has been observed, and research says that the MSH is associated with secretion of the ACTH. So more the ACTH, more the MSH, and the opposite also works. Now, if I come to the two hormones of the posterior pituitary gland, as I told you earlier, it is neurogenic in function. The hormones are not produced in the posterior pituitary, but are secreted. So they are coming from the higher centers of the brain. And the two hormones are very, very important. The first is the antidiuretic hormone, also known as the vasopressin. As its name says, vaso is the blood vessel, pressing is something that compresses it. So the antidiuretic hormone, that is a hormone that reduces the amount of urine that is being thrown out of the body. So it is so important. It regulates the water balance of my body. It controls the outflow of fluid. So it presses the blood vessels. And the moment the blood vessels are pressed, the amount of the GFR reduces. And so the formation of urine. It is a very, very important hormone in conditions like excessive outflow of fluids from our body. The body immediately senses the dehydration and ADH starts getting secreted. So it is in a way a life-saving hormone. This, it has two primary functions: to retain the blood, to retain the water in the body, and to constrict our blood vessels. Now, there is a disease which is known as the diabetes insipidus, or we also call it as the watery diabetes, or we also, in layman terms, we also call it as a diabetes with excessive urine flow. So the difference between diabetes mellitus and insipidus is that in diabetes insipidus, ADH secretion is suppressed. So the body will throw out a lot of water. This water will be plain. This will have very less amount of minerals and discharges, but it will dehydrate the body. Excessive diluted urine will come out of the body. Patient will have excessive thirst, but not excessive hunger, which is seen in diabetic mellitus patients. And the mellitus urine is having a higher concentration of sugar if it crosses the renal threshold. That is, the blood sugar rises beyond 180 milligram blood per deciliter of blood, it will be present in the urine. So these two diabetes are different. It was called diabetes because it was identified by the loss of fluid from the body. And at that time, diabetes mellitus was being identified as a disease with polydipsia, polyuria, and polyphagia. So anything with excessive thirst, excessive urination, and excessive hunger was called diabetes. Though this was different, but it was called diabetes, later named as insipidus, that is thirsty diabetes. Polyuria is excessive flow of urine. Normal urine outflow from an adult body is somewhere around 1.5 liters. And when it is more than 2 or 2.5 liters, we call it polyuria. The last hormone of the pituitary, posterior pituitary, is the oxytocin. Again, it is synthesized in the hypothalamus, secreted by the posterior pituitary. It is a magic hormone. It is the hormone which allows the mother to contract her uterus and deliver her child. It acts only on few moments of life, because a lady would deliver a child maybe once or twice or maybe maximum up to 3 or 4 times. Another function of the oxytocin is the contraction of the mammary glands to produce milk. So this is a wonderful hormone. Imagine if the lady is not having sufficient contractions, that is, there is a deficiency of this oxytocin, she can develop complications. Nowadays, external injectable oxytocin is given to the mother so that she can deliver a normal child. So this becomes a hormone which is secreted on calculated occasions, but which has got a lot of significance. So we saw the hormones of the pituitary, the anterior and the posterior. We have in brief seen how they function. Now, I would request you all to take good amount of notes, go through your books, the sessions, and if there are any questions, you may straight away put them in the query box, in the comment section, and I'll get back to you for that. Thank you for your patience hearing. Have a nice day.